Hey, I'm Megan, and I'm going to do the Foley catheter pass off. So first I'm going to check my MAR, my record for the patient, and it says that he needs a Foley catheter inserted. I checked over his allergies. According to his chart, he doesn't have an allergy to iodine or latex, but I'm going to confirm that with him when I go into the room. I'm going to gather all of my supplies, and then I'm going to enter the room. Hi, Jonah, how are you today? Oh, you're doing good. That's good. So in your chart, your doctor has ordered that I put a catheter in today, okay? Do you think that would help? Yeah, I think it would help a lot. Okay, so what we're gonna do first is I'm gonna have you verify your name and your birth date. Good. Yep, that's who I've got. I'm gonna check your wristband. Perfect. Okay, and then I'm gonna close the door for privacy, okay? Okay, and then, do you have any allergies to iodine or latex? Great, that's what we like to hear. Okay, and I didn't notice any limitations or anything like that, so he should be okay for me to just put his catheter in. Okay, so I'm gonna get you up to a comfortable working height for me, okay? And then are you okay laying flat? Is that okay? Okay, good. Okay, so we're gonna roll his blanket down just a little bit, just to expose the area that I need. And if he was one that was prone to getting cold, I could put a bath blanket over the top portion of him, but he said he's okay for today. Oh, and it looks like we're gonna change out our catheter today. So, need a syringe.
Where's the...
Yeah, I didn't realize you already had a catheter in.
It's right there.
So we're just actually gonna change it because it's been a week, okay? Yeah. So let me grab some gloves, okay? Has it helped you? Well, that's good. Yeah, that's really good. So what we're gonna do first is I'm just gonna clean you up a little bit, okay? Before I remove this one. Yeah, we're just trying to prevent any infections from coming. So if we keep you clean, then, so I'm gonna start at the tip, and then each swipe down, I'm gonna use a different part of my wipe. Okay. All right, and then in the chart, it says that there was about 5 cc's in the balloon. So we're gonna make sure that we pull out 5 cc's. Should just come. Okay, good. Okay, so we got that one out. Okay, I'm gonna take off my gloves and perform hand hygiene again. Okay, and then I'm gonna put on a new pair of gloves. Yeah, we do go through a lot of gloves here, huh? I know. Well, it's just to help prevent infection, you know? That's just something we gotta do. Okay. So I'm just gonna do a little bit more cleaning on you, okay? Yep. At least the wipes are warm, right? That kind of helps a little bit, huh? Okay, so then I'm gonna start at the tip and go around the tip, and then go down a little bit more with a different type of part of the wipe, and then down a little bit further with a different part of the wipe. And then, if we notice that it was a little bit dirty, we could clean the anus and the scrotum, just to keep things nice and clean. Okay, there we go. And I have my garbage can close by, and I have adequate lighting for this procedure, so I don't have to worry about that. Okay, Jonah, so we are all ready to go. So what I'm gonna do now is I'm gonna open up my sterile package, okay? Yeah, it's just to help it so that you don't get in those infections that we were talking about, okay? So I have my leg thing, and then this way a little bit, just to make sure I don't bump anything. Okay, this way, and away from me first. actually going to open them. Let's see. I just don't want to break my sterile field, so we're gonna open them right here. Okay, so for the first glove, I'm gonna grab it by the cuff. I don't want to touch any of the sterile stuff. So I'm gonna go like this and come away from everything. And then maybe put them in. There we go. Okay, and this one I can go underneath the cuff. This one is sterile. Okay, and then I can kind of adjust this a little bit. Okay, so now I'm sterile. So first of all, I'm going to use my drape. Here, open it up up here so as to not touch anything. I did notice before doing any cleaning that I had a Chuck's pad underneath already, so I didn't have to worry about grabbing one of those. Okay. If it was a female, she would be in dorsal recumbent position, and I just realized that I touched that with my wrist, so I would have gotten a new sterile drape. But for the purposes, I'm not going to get anyone. We're just going to place it on here. Okay, and I'm going to open up my stuff. These are just extra. I don't need them. I'm going to open up my swabs. Okay, and then I'm going to hand these to my assistant. Make it easier. Okay. And then I have my other label for when we do our sample. I'm going to open up my lubricating jelly. Okay, then I'm going to open up my catheter. As I do it, I'm going to coil it in my hand so as to be sure that it doesn't fling out. Okay, and then I'm going to put this end in the jelly. Just have it ready to go. And then in my syringe, I only need 5 cc's because according to the hub, that's what it says. So I'm going to squirt some of it out. Okay. And I'm going to attach it. Okay, so I have all my things ready. So now I'm going to bring my tray over to my sterile field. Make sure that I don't touch anything. Okay, and then I don't think that touched anything, but if it did come out and touch his penis or his leg, I would have made sure to just get a whole new set of everything. But I don't think it did, so we're just gonna continue. I'm going to hold his penis, and now this hand is not sterile anymore. So I'm gonna start at the tip and go all the way around, making sure I do 1 swab for each one. I'm going to do a little bit lower. And then 1 more time around. Okay. And then I'm going to get my catheter out of here. insert it 3 to 4 inches, or about 2 to 3 inches until we start seeing some good urine output. Okay, and then since we're in as far as I'm going to go, I can use my non-clean hand. And then we're going to insert the 5 milliliters of water, or of saline. I'm gonna pull it, okay, it won't come out. And then take that off. And then we're gonna move my stuff. So what I would do at this time is I would grab a wipe and clean him up from any lubricating jelly that he might have on him or anything that might have come out as we were inserting it. Okay, and then I would take off my gloves and get some clean gloves on for hand hygiene. And then I would attach this to his inner thigh. Sort of, attach this stuff right here. So now I would attach this to his inner thigh like this, and then just right at the bifurcation. And then it would sit about right there because you want to have a little bit of slack in it so it's not tight. And then I would put this on this bed frame, not on the bed rail, because you want it somewhere that's not going to come out. And then since this is a brand new bag, I could grab my sample out of that bag right away, and then I would label it and date it and take it to the lab or put it in the fridge for later. And then I would make sure I label the bag so that we know when that needs to be changed. And then I would get the patient situated. Was that okay for you? Yeah, they're not the most comfortable procedures, but hopefully it helps you to feel a little bit better, huh? Okay, well, I'm gonna set you up, get you comfortable. And then I would notice anything. If he had any issues with it being placed, then I would make sure and document that. I would document how many cc's of fluid I put into the ball so that when we go to take it out, we know how much is in there. And then I would make sure that I chart everything, and you're good to go, Mr. Dinnerman, okay? Have a good day.